I'm Amy Jones and I work in intensive care in Portsmouth hospitals. I've been working here since 2018 and I'm an intensive care nurse. So Mercy Ships is a charity. It's a medical charity that seeks to bring hope and healing to the world's forgotten poor, and it does that with hospital ships. So it has the biggest civilian hospital ships in the world that go around the coastline of Africa normally, or other countries that have coastlines that are particularly poor. The idea is that they give healthcare, normally surgical care, to people that just can't afford it or don't have access to those particular surgeries. So it looks like a hospital, and when you're on it you wouldn't know you're on a ship, but it's a ship full of people that just want to help and bring healthcare to where it isn't readily available. My husband and I signed up to Mercy Ships in 2013 and lived on board a hospital ship for 5 years. Yep, so I left a job in London in St Thomas's Hospital as an ICU nurse, and we decided to sign up with Mercy Ships. We first went to the Republic of Congo, and we're in a city called Point Noir. We were there for 6 or 7 months, and I was a ward nurse. I worked in MaxVax and post-op and intensive care. I think the poverty was a shock to begin with, especially in some African cities that we went to that had actually quite a lot of money in the main cities and had a fairly comfortable style of living, especially in places like Dakar and Point Noir. But actually in the villages there was real poverty, and people did not have access to the simplest of operations or services, especially things like dental care. I was really surprised by some of our maxillofacial tumours that were a couple of kilos heavy, that were purely from bad dental work and not having any access to dental care. And that was a real shock, that something so simple that's so treatable and preventable can cause such a massive effect on somebody's life and end in death when there's no services available for it. So I think it was a real shock to see how preventable stuff was, but also how easily we could help and provide surgery for those things so that those patients could go and have a normal life. So I went back with my family this summer, and it was great. It was great to go back to the ship. It was great to go back with the family, and also to see Madagascar 8 years on, where we'd spent 2 years and we'd worked really hard on different projects, and gone back 8 years later with our family. And yeah, it was really great. It was great to see some old friends, see some old colleagues. We met up with some of our nursing staff that we worked with, and doctors and anaesthetists, and it was really nice to catch up with them and see how they had progressed and how their services had evolved, and how they were kind of running with what we started, basically, and making healthcare safer for the people of their country. I think one of my favourite stories was we had a translator called Sandra who was helping us translate to our patients in Malagasy. So we would, whether it was kind of signing their consent for their surgery, or doing teaching post-operatively, or whether it was actually teaching nurses and anaesthetists and doctors in different training and mandatory updates, he would be the one that would help us to translate all of these things into Malagasy, or French, languages spoken in Madagascar. And he worked with us for a year and felt so strongly about some of the things that we were teaching, things like ethics and dignity and privacy for our patients, and compassion, actually, in a world where there's not a lot of money and everyone's fighting to survive, things like bribery in hospital settings and lots of corruption is rife, and he felt so strongly that those things were wrong and that he wanted to fight against them and give patients good healthcare without being bribed. He decided to become a nurse, so he worked with us for a year translating, and then enrolled in a local university. And he was not from a background of money. He worked really hard, and he is now a qualified nurse in his own country, and really striving to treat patients equally and well without taking bribes. And that was a really lovely moment, because now I know he's there and he's had so much investment in teaching, and he's working in Malagasy hospitals to try and make things better for patients. And we worked quite hard in infrastructure and training and things that would really last, rather than giving a machine that 5 years down the line won't work, but actually really trying to train people and invest in people so that they can continue to teach and pass on knowledge and treat patients well. So that's a really great thing to know, that we've left things behind that will last longer than we did.